What counts as valid informed consent for plastic surgery? Imagine making a big decision about your body. Before any plastic surgery, it's essential that you fully understand what you're agreeing to. That's where valid informed consent comes in. It's not just about signing a paper. It's a process that makes sure you're making a voluntary and educated choice. Informed consent is a core part of medical ethics and safety, especially in elective procedures like plastic surgery. It protects your rights and helps ensure your safety. For consent to be valid, several important things need to happen. First, you must have the capacity to understand the information. This usually means you're an adult, typically over 18. If you're a minor, a parent or guardian must give consent on your behalf. The surgeon must clearly explain what the procedure involves, including how it's done, what results you can expect, and any limitations. They should also discuss alternative options, including choosing not to have surgery at all. You need to be told about the risks and possible complications. These can include infection, scarring, anesthesia risks, or unsatisfactory results. It's also important to understand the potential benefits, like improved appearance or confidence, but with realistic expectations. The decision must be made freely, without pressure or coercion. You should feel comfortable asking questions and having them answered honestly. Documentation is a key part of the process. Usually, you'll sign a consent form that summarizes what was discussed. But signing alone doesn't mean you truly understand everything. The information should be provided in a language you understand, and if needed, a professional interpreter should be involved. The consent process isn't a one-time event. You should have ongoing opportunities to ask questions or express concerns before moving forward. In plastic surgery, because procedures are often elective, the standards for informed consent tend to be more rigorous. Patients should have plenty of time to think about their decision and should never feel rushed. Surgeons have an ethical duty to ensure that patients are choosing surgery for the right reasons and that their expectations are realistic. If someone lacks the capacity to consent, perhaps due to a mental health condition, the surgeon must postpone or decline the procedure until the person is able to make an informed choice. In summary, valid informed consent means that the patient or guardian understands the procedure, risks, benefits, and alternatives, makes the decision voluntarily, and has the opportunity to ask questions. It must be documented properly and communicated in a way that's clear and accessible. Respecting patient autonomy is at the heart of ethical plastic surgery. Always remember to consult qualified healthcare professionals for personalized advice, as each person's situation is unique and requires careful consideration.